Question 1. Risk assessment procedures indicate that a certified TDM professional must maintain up-to-date knowledge of evolving practices. Which of the following represents the most robust and professionally responsible approach to staying informed about current TDM methodologies, clinical applications, and emerging drug monitoring needs? Option A. Basing updates solely on informal discussions and anecdotal experiences shared among colleagues during routine laboratory operations. Option B. Accepting information exclusively from pharmaceutical company representatives and their promotional materials. Option C. Primarily relying on information shared in online professional forums and social media groups dedicated to TDM. Option D. Regularly reviewing peer-reviewed scientific journals, participating in accredited continuing education courses, and consulting guidelines from recognized professional TDM organizations. The correct answer is D. Regularly reviewing peer-reviewed scientific journals, participating in accredited continuing education courses, and consulting guidelines from recognized professional TDM organizations. Explanation. Scenario analysis. Staying current with therapeutic drug monitoring, TDM practices, is professionally challenging due to the rapid evolution of analytical methodologies, emerging drug classes requiring TDM, and updated clinical guidelines. Professionals must navigate a vast amount of information to identify reliable and relevant updates that impact patient care and laboratory operations. Failure to do so can lead to suboptimal patient outcomes, non-compliance with regulatory standards, and inefficient resource allocation. The challenge lies in discerning credible sources from less authoritative ones and integrating new knowledge effectively into daily practice. Correct approach analysis. The best professional practice involves actively engaging with a multifaceted approach to staying updated. This includes regularly consulting peer-reviewed scientific literature, participating in accredited continuing education programs, and engaging with professional organizations that provide evidence-based guidelines and best practice recommendations. For the TDM certification exam, this implies a commitment to continuous learning that aligns with the standards set by relevant professional bodies and regulatory agencies governing laboratory practice and patient safety. This approach ensures that knowledge is current, evidence-based, and directly applicable to clinical scenarios, thereby upholding the highest standards of patient care and professional competence. Incorrect approach is analysis. Relying solely on anecdotal evidence or informal discussions with colleagues, while potentially offering quick insights, represents a significant regulatory and ethical failure. This approach lacks the rigor of peer review and evidence-based validation, potentially leading to the adoption of outdated or incorrect practices. It fails to meet the professional obligation to base clinical decisions on the most current and reliable scientific data, which is a cornerstone of patient safety and quality assurance in healthcare. Accepting information exclusively from pharmaceutical company marketing materials is also professionally unacceptable. While these materials can provide product-specific information, they are inherently biased and may not present a balanced view of a drug's therapeutic profile or TDM requirements. This approach risks prioritizing commercial interests over objective clinical evidence and patient well-being, violating ethical principles of professional integrity and evidence-based practice. Limiting updates to information disseminated through a single, non-accredited online forum or social media group is another failure. Such sources often lack editorial oversight, quality control, and may not reflect the consensus of the TDM community or regulatory expectations. This can lead to the propagation of misinformation and a deviation from established best practices, potentially compromising patient safety and the credibility of the practitioner. Professional reasoning. Professionals must adopt a systematic and critical approach to information gathering. This involves prioritizing sources that are peer-reviewed, evidence-based, and endorsed by recognized professional bodies. A continuous learning plan should incorporate diverse learning modalities, including formal education, literature review, and engagement with professional communities. When evaluating new information, practitioners should ask, is this source credible and unbiased? Is the information supported by robust scientific evidence? Does this align with current clinical guidelines and regulatory requirements? This critical evaluation process ensures that practice remains current, safe, and effective. Question 2. Examination of the data shows a patient's serum concentration for a prescribed medication is below the established therapeutic range. The patient reports feeling subjectively well and denies any adverse effects. What is the most appropriate next step in managing this patient's therapy? Option A. Assess the patient's clinical response and signs of therapeutic efficacy before considering any dosage adjustments. Option B. Immediately increase the medication dosage to bring the concentration within the therapeutic range. Option C. Retest the drug level immediately without further clinical assessment. Option D. Discontinue the medication as the current level is not achieving therapeutic goals. The correct answer is A. Assess the patient's clinical response and signs of therapeutic efficacy before considering any dosage adjustments. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic drug monitoring, TDM, where a patient's drug concentration falls outside the established therapeutic range. The professional must interpret this data within the context of the patient's clinical presentation and the drug's known pharmacodynamics and pharmacokinetics. The challenge lies in balancing the need to maintain efficacy with the risk of toxicity, all while adhering to established guidelines and ensuring patient safety. The decision-making process requires a nuanced understanding of the therapeutic range's significance beyond mere numerical boundaries. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's clinical status alongside the drug concentration. The therapeutic range is not an absolute determinant of efficacy or toxicity, but rather a guide. A concentration below the therapeutic range may still be effective if the patient is asymptomatic and showing clinical improvement. Conversely, a concentration within the range can be associated with adverse effects in some individuals. Therefore, the best professional practice is to correlate the drug level with the patient's signs, symptoms, and overall clinical response. This aligns with the ethical imperative to provide individualized patient care and the regulatory expectation to practice within established clinical guidelines for TDM, which emphasize clinical correlation. Incorrect approaches analysis. One incorrect approach is to immediately adjust the drug dosage solely based on the concentration falling below the therapeutic range, without considering the patient's clinical presentation. This fails to acknowledge that some patients may respond adequately to lower concentrations, and unnecessary dose increases can lead to toxicity and increased healthcare costs. This approach violates the principle of individualized care and could be seen as a deviation from best practice guidelines that mandate clinical correlation. Another incorrect approach is to dismiss the low drug concentration as insignificant because the patient is currently asymptomatic. While a patient may be asymptomatic, a subtherapeutic level could indicate a risk of treatment failure or relapse, especially for drugs with narrow therapeutic windows or critical indications. This approach overlooks the proactive aspect of TDM, which aims to prevent adverse outcomes by ensuring adequate drug exposure. It also fails to adhere to the spirit of TDM, which is to optimize therapy based on both drug levels and clinical response. A third incorrect approach is to assume that any concentration below the therapeutic range automatically necessitates a dose increase, regardless of the drug's half-life or the time since the last dose. This ignores crucial pharmacokinetic principles and can lead to rapid overshooting of the therapeutic range, increasing the risk of toxicity. It demonstrates a superficial understanding of TDM and a failure to apply a holistic, evidence-based approach to patient management. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient-centered care and evidence-based practice. This involves 1. Reviewing the patient's current clinical status, including signs, symptoms, and response to therapy. 2. Interpreting the drug concentration in light of the established therapeutic range and the drug's pharmacokinetic and pharmacodynamic properties. 3. Correlating the drug level with the clinical picture to determine if the concentration is contributing to or detracting from the desired therapeutic outcome. 4. Considering factors such as the time of sample collection relative to dosing, potential drug interactions, and patient-specific variables, e.g., renal or hepatic function. 5. Formulating a management plan that may involve dose adjustment, continued monitoring, or further investigation, always with the goal of optimizing patient safety and therapeutic efficacy. Question 3. Performance analysis shows a patient receiving a specific immunosuppressant drug for organ transplantation has a trough drug concentration within the established therapeutic range. However, the patient is exhibiting signs of organ rejection. Considering the principles of therapeutic drug monitoring, TDM, which of the following approaches best guides the clinical decision-making process in this scenario? Option A. Focus solely on achieving a higher drug concentration by adjusting the dosing schedule, without further investigation into the cause of rejection. Option B. Evaluate the patient's pharmacodynamic response to the current drug concentration, considering factors that might be contributing to suboptimal efficacy despite adequate levels, and adjust therapy based on both pharmacokinetic and pharmacodynamic data. Option C. Increase the drug dosage to achieve a higher concentration, assuming this will overcome the rejection. Option D. Discontinue the current immunosuppressant and switch to a different drug class immediately, as the current drug is clearly failing. The correct answer is C. Increase the drug dosage to achieve a higher concentration, assuming this will overcome the rejection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinician to interpret complex patient data and make a critical treatment decision based on the interplay between how the body handles a drug, pharmacokinetics, and how the drug affects the body, pharmacodynamics. Misinterpreting this relationship can lead to suboptimal therapeutic outcomes, adverse drug events, or even patient harm. The challenge lies in moving beyond simple concentration-response correlations to a nuanced understanding of individual patient variability and the specific mechanisms of drug action. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core principles of therapeutic drug monitoring, TDM, as defined by relevant professional guidelines and regulatory frameworks. It emphasizes integrating both pharmacokinetic parameters, e.g., drug absorption, distribution, metabolism, excretion, and pharmacodynamic effects, e.g., observed clinical response, side effects, target engagement, to optimize therapy. This holistic view ensures that drug concentrations are not just within a target range, but are also achieving the desired clinical effect while minimizing toxicity, aligning with the ethical imperative to provide patient-centered care and adhere to the principles of evidence-based practice. Incorrect approaches analysis. One incorrect approach fails to consider the pharmacodynamic implications of the drug concentration. This is a regulatory and ethical failure because it reduces TDM to a purely pharmacokinetic exercise, ignoring the ultimate goal of therapy, achieving a therapeutic effect. This can lead to situations where a drug concentration is within the therapeutic range, but is not producing the desired clinical outcome, or conversely, is causing toxicity despite being within range due to individual patient factors influencing response. This violates the principle of individualized patient care. Another incorrect approach focuses solely on pharmacodynamic markers, without considering the pharmacokinetic drivers of drug concentration. This is a failure because it neglects the fundamental understanding of how drug levels are achieved and maintained in the body. Without pharmacokinetic insight, it's impossible to predict how dose adjustments will impact future drug concentrations and thus the pharmacodynamic response. This can lead to erratic dosing strategies and an inability to achieve stable therapeutic effects, potentially resulting in subtherapeutic levels or toxicity, which is a breach of professional responsibility to manage drug therapy effectively. A third incorrect approach relies on generic population-based guidelines without considering individual patient variability in both pharmacokinetics and pharmacodynamics. This is a significant regulatory and ethical failure. TDM's value lies in its ability to personalize drug therapy, ignoring individual patient factors such as genetics, organ function, and comorbidities can lead to inappropriate dosing, ineffective treatment, or preventable adverse events. This approach contravenes the ethical obligation to provide care tailored to the unique needs of each patient and the regulatory expectation for evidence-based, individualized treatment. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's clinical status and the drug's known pharmacokinetic and pharmacodynamic profile. This involves reviewing laboratory data, drug concentrations, relevant biomarkers, alongside clinical observations, symptoms, signs of efficacy, adverse events. The next step is to analyze how the patient's individual characteristics might be influencing these parameters. Based on this integrated understanding, potential interventions, e.g., dose adjustment, timing change, alternative therapy, are considered, always prioritizing patient safety and therapeutic goals. This iterative process of assessment, analysis, and intervention, guided by both scientific principles and ethical considerations, forms the bedrock of effective TDM practice. Question 4. quality control measures reveal a significant deviation outside acceptable limits for a critical therapeutic drug level assay. The laboratory is experiencing high patient volume, and there is pressure to release pending results promptly. What is the most appropriate immediate action for the TDM specialist? Option A. Investigate the root cause of the quality control deviation and resolve it before releasing any patient results. Option B. Release the patient results that fall within a plausible range and hold only those that appear significantly abnormal based on the QC issue. Option C. Continue running patient samples while initiating a retrospective investigation of the quality control deviation. Option D. Release the pending patient results, assuming the deviation is a minor anomaly and will not significantly impact clinical decisions. The correct answer is A. Investigate the root cause of the quality control deviation and resolve it before releasing any patient results. Explanation. This scenario presents a professional challenge because it requires a TDM specialist to interpret quality control data in the context of patient care and regulatory compliance. The challenge lies in balancing the immediate need for accurate therapeutic drug levels with the potential implications of QC deviations on patient safety and the integrity of the laboratory's TDM services. Careful judgment is required to determine the appropriate course of action without compromising patient outcomes or violating established guidelines. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory standards. By investigating the root cause of the QC deviation before releasing patient results, the TDM specialist ensures that the reported values are accurate and reliable. This aligns with the fundamental principles of TDM, which aim to optimize drug efficacy and minimize toxicity. Regulatory frameworks, such as those governing laboratory accreditation and good laboratory practices, mandate that QC procedures are followed rigorously to ensure the validity of test results. Failure to investigate QC issues before releasing patient data could lead to incorrect clinical decisions, potentially harming patients and violating laboratory quality standards. Incorrect approaches are professionally unacceptable due to specific regulatory and ethical failures. Releasing patient results without investigating the QC deviation disregards the potential for inaccurate reporting, which directly impacts patient care and violates the ethical obligation to provide reliable diagnostic information. This also contravenes regulatory requirements for quality assurance in clinical laboratories, which mandate that all testing be performed under controlled conditions and that any deviations from expected performance be addressed. Furthermore, continuing to run patient samples without resolving the QC issue demonstrates a lack of diligence and a failure to uphold professional standards, potentially leading to a cascade of erroneous results and a breach of trust with clinicians and patients. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and document the QC deviation immediately. 2. Halt the release of patient results associated with the affected QC run. 3. Initiate a thorough investigation into the root cause of the QC failure, considering factors such as reagent integrity, instrument calibration, operator technique, and environmental conditions. 4. Implement corrective actions based on the investigation findings. 5. Rerun QC samples to confirm that the system is now performing within acceptable limits. 6. Only after successful QC retesting and confirmation of system stability, proceed with the release of patient results. 7. Document all actions taken, including the investigation, corrective measures, and retesting results, for regulatory compliance and internal quality improvement. Question 5. Analysis of patient receiving both vancomycin and phenytoin, with recent trough levels indicating vancomycin is within the target range but phenytoin is slightly below its therapeutic window, presents a complex risk assessment challenge. Considering the potential for drug-drug interactions and individual patient factors, which of the following approaches best mitigates patient risk and ensures optimal therapeutic outcomes? Option A. Recommend a vancomycin dose reduction due to potential additive nephrotoxicity with phenytoin, despite vancomycin being within its target range. Option B. Conduct a comprehensive risk assessment, evaluating the combined impact of vancomycin and phenytoin on renal and hepatic function, the patient's clinical status, and potential interactions before recommending any dose adjustments. Option C. Increase the phenytoin dose solely based on its trough level, while maintaining the current vancomycin regimen, Option D. Hold both vancomycin and phenytoin until a new baseline of patient stability is achieved, irrespective of current clinical presentation. Correct answer is C. Increase the phenytoin dose solely based on its trough level while maintaining the current vancomycin regimen. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic drug monitoring, TDM, where a patient on multiple medications with narrow therapeutic indices requires careful management. The complexity arises from potential drug-drug interactions, individual patient variability in metabolism and excretion, and the need to balance efficacy with toxicity. The risk assessment must consider not only the individual drug levels, but also the synergistic or antagonistic effects of co-administered drugs, patient-specific factors like renal and hepatic function, and the clinical presentation. Failure to adequately assess these interacting factors can lead to subtherapeutic efficacy, increased toxicity, or both, directly impacting patient outcomes and potentially violating professional standards of care. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates multiple data points. This includes evaluating the therapeutic drug levels of each monitored medication, e.g., vancomycin and phenytoin, in the context of the patient's clinical status, renal and hepatic function, and other concomitant medications. This holistic approach aligns with best professional practice by prioritizing patient safety and optimizing therapeutic outcomes. Regulatory frameworks for TDM certification emphasize the importance of understanding drug interactions and individual patient factors to ensure appropriate dosing and monitoring, thereby minimizing adverse events and maximizing therapeutic benefit. This approach is ethically sound, as it demonstrates a commitment to patient-centered care and adherence to established clinical guidelines. Incorrect approaches analysis. Focusing solely on achieving target trough levels for each individual drug without considering their interactions or the patient's overall clinical picture represents a significant regulatory and ethical failure. This narrow focus ignores the potential for synergistic toxicity or reduced efficacy due to drug-drug interactions, which is a critical aspect of TDM. Such an approach could lead to inappropriate dose adjustments that either increase the risk of adverse effects or fail to achieve the desired therapeutic outcome, violating the principle of providing competent and safe patient care. Furthermore, neglecting to consider patient-specific factors like renal function when interpreting vancomycin levels or hepatic function when interpreting phenytoin levels directly contravenes established TDM guidelines and regulatory expectations for safe and effective drug management. This can be seen as a failure to exercise due diligence and professional judgment, potentially leading to patient harm and professional misconduct. Professional reasoning. Professionals should adopt a systematic risk assessment process. This begins with identifying all monitored drugs and their therapeutic targets. Next, gather all relevant patient data, clinical signs and symptoms, laboratory results including renal and hepatic function, and a complete medication list. Critically evaluate potential drug-drug interactions between the monitored drugs and any other prescribed or over-the-counter medications. Correlate drug levels with the patient's clinical response and any signs of toxicity. Finally, integrate all this information to make informed dosing recommendations that balance efficacy and safety, always documenting the rationale for decisions. This iterative process ensures that patient care is individualized and responsive to changing clinical conditions. Question 6. Stakeholder feedback indicates that a patient undergoing therapeutic drug monitoring for a specific antibiotic is exhibiting signs of potential subtherapeutic drug levels, despite the prescribed dosage aligning with standard guidelines. The patient has recently experienced significant fluid shifts due to a medical condition, which is known to affect the volume of distribution and protein binding of many medications. The current TDM results are within the lower end of the therapeutic range. What is the most appropriate course of action for the TDM certified professional? Option A. Proceed with the current prescribed dosage, assuming the TDM results, even at the lower end of the range, are sufficient for therapeutic efficacy. Option B. Interpret the current TDM results as definitive and disregard the patient's recent physiological changes as having no significant bearing on the drug's effectiveness. Option C. Independently adjust the antibiotic dosage based on the perceived impact of fluid shifts on volume of distribution and protein binding, without consulting the prescriber. Option D. Consult with the prescribing physician to discuss the patient's altered physiological state and its potential impact on the drug's volume of distribution and protein binding, proposing a review of the current dosage in light of these factors. The correct answer is D. Consult with the prescribing physician to discuss the patient's altered physiological state and its potential impact on the drug's volume of distribution and protein binding, proposing a review of the current dosage in light of these factors. Explanation. Scenario analysis. This scenario presents a professional challenge due to conflicting information regarding a patient's medication and the potential impact of their physiological state on drug distribution. The clinician must reconcile the prescribed dosage with the patient's known factors affecting volume of distribution and protein binding, while also considering the ethical imperative to provide safe and effective care. The challenge lies in applying TDM principles to a complex clinical picture without direct laboratory data, necessitating a judgment call based on understanding of pharmacokinetic principles and their clinical implications. Correct approach analysis. The correct approach involves a proactive and collaborative strategy, consulting with the prescribing physician to discuss the potential impact of the patient's altered protein binding and increased volume of distribution on the current drug regimen is paramount. This aligns with best professional practice by prioritizing patient safety and ensuring optimal therapeutic outcomes. It demonstrates adherence to ethical principles of beneficence and non-maleficence, as well as professional responsibility to advocate for the patient. This approach also implicitly acknowledges the limitations of current information and seeks to rectify it through appropriate channels, respecting the roles within the healthcare team. Regulatory frameworks for TDM certification emphasize the importance of understanding drug disposition and making informed clinical decisions, which this approach directly addresses. Incorrect approaches analysis. One incorrect approach involves proceeding with the prescribed dose without further investigation or consultation. This fails to acknowledge the significant physiological changes that can drastically alter a drug's volume of distribution and protein binding, potentially leading to subtherapeutic levels or toxicity. This is a direct violation of the principle of providing evidence-based care and can be considered negligent. Ethically, it breaches the duty of care. Another incorrect approach is to unilaterally adjust the dosage based solely on the perceived impact of the patient's condition without consulting the prescriber. While the clinician may have a strong understanding of TDM principles, the prescribing physician retains ultimate responsibility for the medication regimen. Such an action bypasses established communication protocols and could lead to unintended consequences or conflicts within the healthcare team. This demonstrates a lack of professional collaboration and can be seen as overstepping professional boundaries, potentially violating guidelines on interprofessional communication and patient management. A third incorrect approach is to dismiss the patient's altered physiological state as irrelevant to the current TDM results, assuming the laboratory values are definitive. This demonstrates a fundamental misunderstanding of pharmacokinetics and the dynamic nature of drug distribution. Protein binding and volume of distribution are critical determinants of drug concentration at the site of action, and ignoring their influence can lead to misinterpretation of TDM results and inappropriate therapeutic decisions. This approach fails to meet the competency standards expected of a certified TDM professional, who must integrate all relevant patient data into their assessment. Professional reasoning. Professionals should adopt a systematic approach when faced with such dilemmas. First, identify the core issue, a potential discrepancy between prescribed therapy and patient physiology impacting drug distribution. Second, gather all available information, including patient history, current medications, and any available laboratory data. Third, apply knowledge of pharmacokinetic principles, specifically volume of distribution and protein binding, to hypothesize potential impacts. Fourth, consult relevant guidelines and literature. Fifth, communicate concerns and proposed actions to the prescribing physician, advocating for the patient's best interest. This collaborative and evidence-informed process ensures patient safety and adherence to professional and ethical standards. Question 7. Process analysis reveals that a patient's therapeutic drug monitoring, TDM, results for a specific medication are higher than anticipated based on their prescribed dosage. Which of the following approaches best reflects a comprehensive understanding of factors influencing drug levels in this scenario? Option A. Evaluating the TDM results by considering a combination of the patient's age, weight, current disease states, e.g., renal or hepatic impairment, and potential drug-drug interactions, alongside genetic factors. Option B. Analyzing the TDM results solely in relation to the prescribed dose, concluding that the patient is likely non-adherent or the laboratory assay is inaccurate. Option C. Prioritizing the patient's genetic makeup as the primary determinant of the elevated drug level, assuming a known polymorphism significantly impacts metabolism. Option D. Focusing exclusively on the patient's weight as the sole contributor to the elevated drug level, suggesting a need for dose reduction based on body mass index. The correct answer is C. Prioritizing the patient's genetic makeup as the primary determinant of the elevated drug level, assuming a known polymorphism significantly impacts metabolism. Explanation: this scenario is professionally challenging because accurately interpreting TDM results requires a comprehensive understanding of numerous patient-specific factors that can significantly alter drug concentrations, independent of the administered dose. Failure to account for these variables can lead to inappropriate dose adjustments, potentially resulting in subtherapeutic efficacy or toxic effects. The correct approach represents best professional practice because it demonstrates a commitment to individualized patient care, aligning with the ethical imperative to optimize therapeutic outcomes and minimize harm. This aligns with regulatory expectations for pharmacists and clinicians to utilize all available patient data to inform therapeutic decisions. The correct approach is best professional practice because it systematically considers the interplay of multiple physiological and genetic factors that influence drug disposition and response. This holistic evaluation ensures that TDM results are interpreted within the context of the individual patient's unique profile, leading to more precise and effective therapeutic interventions. This aligns with the core principles of patient-centered care and the professional responsibility to apply scientific knowledge to clinical practice. An incorrect approach that focuses solely on the prescribed dose and ignores patient-specific factors represents a significant regulatory and ethical failure, violates the principle of individualized therapy, and can lead to adverse drug events, contravening professional standards and potentially breaching regulatory requirements for safe medication management. Such an approach demonstrates a lack of critical thinking and an insufficient understanding of pharmacokinetics and pharmacodynamics. Another incorrect approach that prioritizes a single influencing factor, such as age, while neglecting others like disease states or genetics, is also professionally unacceptable. This oversimplification can lead to misinterpretation of drug levels and suboptimal treatment. It fails to meet the standard of care expected in TDM, which demands a comprehensive assessment of all relevant variables. Ethically, it can be seen as a failure to provide diligent and thorough patient care. The professional reasoning process for similar situations should involve a systematic review of the patient's clinical presentation, including their age, weight, renal and hepatic function, concurrent disease states, and known genetic polymorphisms that may affect drug metabolism or transport. This information should be integrated with the TDM results and the drug's pharmacokinetic profile to determine the most appropriate therapeutic course of action. Professionals must continuously update their knowledge base regarding drug interactions and patient-specific factors to ensure optimal patient outcomes. Question 8. Research into the elimination of a specific antibiotic in a 75-year-old patient with moderate renal impairment reveals that their estimated glomerular filtration rate, eGFR, is significantly reduced. The standard therapeutic drug monitoring protocol for this antibiotic typically relies on a fixed dosing interval and routine trough concentration monitoring. Considering the patient's age and compromised renal function, which of the following actions best reflects a proactive and clinically appropriate response from a TDM-certified professional? Option A. Focus solely on the antibiotic's intrinsic half-life as listed in the drug monograph, disregarding the patient's specific renal status and age as secondary factors. Option B. Continue with the standard dosing interval and routine trough concentration monitoring as per the established protocol, assuming the protocol accounts for typical variations. Option C. Recommend adjusting the dosing interval and or dose based on the patient's reduced renal clearance and potentially prolonged half-life, and schedule more frequent monitoring to assess the impact of these adjustments. Option D. Advise the clinical team to delay further TDM analysis until the patient's renal function shows improvement to avoid potentially misleading results. The correct answer is C. Recommend adjusting the dosing interval and or dose based on the patient's reduced renal clearance and potentially prolonged half-life, and schedule more frequent monitoring to assess the impact of these adjustments. Explanation: this scenario is professionally challenging because it requires a TDM-certified professional to interpret complex patient-specific factors that influence drug elimination, moving beyond simple protocol adherence. The challenge lies in synthesizing information about a patient's renal function, age, and potential drug interactions to make informed therapeutic recommendations, ensuring patient safety and optimal drug efficacy within the established regulatory framework for TDM. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of pharmacokinetic principles and their application to individual patient care. By considering the interplay of renal clearance, half-life, and influencing factors, the professional is actively engaging in personalized medicine, which is a cornerstone of high-quality TDM. This approach aligns with the ethical obligation to provide patient-centered care and the regulatory expectation that TDM services are delivered by qualified professionals who can interpret and act upon complex data. Specifically, adherence to guidelines that mandate consideration of patient-specific variables for dose adjustments is paramount. An incorrect approach that solely relies on standard dosing guidelines without accounting for the patient's specific renal impairment fails to meet the professional standard of care. This oversight could lead to drug accumulation, toxicity, and adverse patient outcomes, violating the principle of do no harm and potentially contravening regulations that require individualized patient assessment. Another incorrect approach that prioritizes convenience over patient safety, such as delaying TDM analysis until the patient is discharged, ignores the critical need for timely therapeutic intervention and monitoring, thereby jeopardizing patient well-being and potentially violating laboratory accreditation standards. A third incorrect approach that dismisses the impact of age on drug elimination overlooks well-established pharmacokinetic principles and can lead to inappropriate dosing, either subtherapeutic or toxic, again failing to meet the standard of individualized care. Professional decision-making in such situations requires a systematic process. First, thoroughly reviewing the patient's medical history, including current renal function e.g., eGFR, creatinine clearance, age, and any co-administered medications that might affect drug metabolism or excretion. Second, consulting relevant TDM guidelines and pharmacokinetic data for the specific drug being monitored, paying close attention to factors that alter elimination. Third, calculating or estimating the patient's likely drug clearance and half-life based on these factors. Finally, formulating a therapeutic recommendation that considers the patient's individual profile to optimize drug efficacy and minimize toxicity, always documenting the rationale for any dose adjustments or monitoring frequency changes. Question 9. Stakeholder feedback indicates that some blood samples collected for therapeutic drug monitoring are being drawn at inconsistent times relative to the patient's last dose, and occasionally without confirming patient identity against wristbands. Considering best practices for blood sample collection in therapeutic drug monitoring, which of the following actions best addresses these concerns to ensure accurate and reliable TDM results? Option A. Suggests that phlebotomists collect samples approximately 1 hour after drug administration to capture peak drug levels, as this is often when adverse effects are most noticeable. Option B. Implement a policy allowing phlebotomists to collect samples using any available blood collection tube, provided it contains an anticoagulant, to ensure sample availability. Option C. Advise phlebotomists to collect samples at any convenient time after drug administration, as long as the patient is identified, to expedite the TDM process. Option D. Reinforce the importance of collecting blood samples at the documented trough concentration, typically just before the next scheduled dose, and mandate strict adherence to patient identification protocols, including double-checking against wristbands and patient records before collection. The correct answer is D. Reinforce the importance of collecting blood samples at the documented trough concentration, typically just before the next scheduled dose, and mandate strict adherence to patient identification protocols, including double-checking against wristbands and patient records before collection. Explanation: this scenario presents a common challenge in therapeutic drug monitoring, TDM, where external factors can compromise the integrity of blood sample collection, directly impacting the accuracy of TDM results and subsequent clinical decisions. The professional challenge lies in ensuring that despite potential disruptions, the collected sample adheres to established best practices and regulatory guidelines to maintain patient safety and therapeutic efficacy. Careful judgment is required to identify and mitigate these external influences. The correct approach represents best professional practice because it prioritizes adherence to established protocols for blood sample collection, specifically addressing the timing relative to drug administration. This aligns with regulatory frameworks that mandate accurate and reliable laboratory testing for patient care. By collecting the sample at the trough concentration, the TDM result provides the most representative measure of the drug's steady-state level in the patient's system, allowing for appropriate dose adjustments. This practice is ethically sound as it ensures that clinical decisions are based on valid data, thereby safeguarding patient well-being and optimizing treatment outcomes. An incorrect approach that involves collecting the sample immediately after drug administration fails to account for the drug's absorption and distribution phases. This would lead to an artificially high and misleading drug concentration, potentially resulting in unnecessary dose reductions or even discontinuation of a necessary medication, thereby compromising patient safety and therapeutic goals. This violates the ethical principle of beneficence and non-maleficence by potentially harming the patient through inaccurate treatment. Furthermore, it deviates from established laboratory and clinical guidelines for TDM, which are often implicitly or explicitly supported by regulatory oversight bodies concerned with laboratory quality and patient safety. Another incorrect approach, collecting the sample without proper patient identification or labeling, represents a critical breach of patient safety protocols and regulatory requirements. This identification of samples can lead to incorrect results being attributed to the wrong patient, with potentially catastrophic consequences, including incorrect medication administration or lack of treatment. This directly contravenes regulations governing laboratory specimen handling and patient identification, as well as fundamental ethical obligations to ensure patient safety and privacy. A third incorrect approach, using an inappropriate collection tube or anticoagulant, can interfere with the laboratory analysis of the drug concentration. Different anticoagulants or tube types can affect drug stability or assay performance, leading to inaccurate results. This undermines the reliability of the TDM test, which is a cornerstone of safe and effective drug therapy, and can be considered a failure to meet the standards of care expected in a regulated healthcare environment. The professional reasoning process for similar situations should involve a systematic evaluation of the sample collection process. This includes understanding the specific drug being monitored, its pharmacokinetic profile, and the established TDM guidelines for that drug. Professionals must be vigilant in identifying potential sources of error, such as timing of administration, patient identification, and specimen integrity. When deviations from best practices are identified, immediate corrective action should be taken, and the situation should be documented and communicated to the appropriate clinical team to ensure patient safety and the validity of the TDM results. This proactive and detail-oriented approach is essential for maintaining high standards of care in TDM. Question 10. The audit findings indicate that a TDM practitioner consistently interprets drug levels based on the drug's average half-life without adequately considering individual patient factors that influence hepatic metabolism. Which approach best addresses the identified audit finding and upholds best professional practice in TDM? Option A. Rely on the drug's established average half-life as the primary determinant for dose adjustments, as this represents the most common metabolic clearance rate. Option B. Focus solely on the patient's reported adherence to the prescribed medication regimen when interpreting TDM results, as this is the most direct factor affecting drug levels. Option C. Systematically assess the patient's hepatic function, concurrent medications for potential enzyme induction or inhibition, and any known genetic factors that may alter drug metabolism before interpreting TDM results. Option D. Prioritize interpreting TDM results based on generic dosing guidelines provided by the drug manufacturer, assuming these are applicable to the majority of patients. The correct answer is C. Systematically assess the patient's hepatic function, concurrent medications for potential enzyme induction or inhibition, and any known genetic factors that may alter drug metabolism before interpreting TDM results. Explanation: the audit findings indicate a potential gap in the understanding and application of drug metabolism principles within a therapeutic drug monitoring (TDM) program. This scenario is professionally challenging because it requires the TDM professional to not only understand the theoretical aspects of phase I and phase II metabolism, hepatic clearance, and enzyme kinetics, but also to apply this knowledge to real-world patient care decisions. Misinterpreting these concepts can lead to incorrect dosing recommendations, suboptimal therapeutic outcomes, and increased risk of adverse drug events. The challenge lies in translating complex biochemical processes into actionable clinical insights. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the patient's metabolic profile and potential drug-drug interactions. This involves systematically evaluating how a patient's hepatic function, genetic predispositions, and concurrent medications might influence the metabolism of a TDM-monitored drug. This approach aligns with the ethical imperative to provide safe and effective patient care, ensuring that TDM results are interpreted within the full clinical context. Regulatory frameworks for TDM certification emphasize the need for practitioners to possess a thorough understanding of pharmacokinetics and pharmacodynamics, including metabolic pathways, to ensure accurate and appropriate therapeutic interventions. An incorrect approach that focuses solely on the drug's intrinsic half-life, without considering individual patient metabolic factors, fails to acknowledge the variability in drug response. This is a regulatory and ethical failure because it neglects the principle of individualized therapy, a cornerstone of safe medication management. It can lead to under- or overdosing, potentially causing treatment failure or toxicity, which violates the duty of care. Another incorrect approach that overlooks the potential for enzyme induction or inhibition by co-administered drugs is also professionally unacceptable. This represents a significant regulatory and ethical failure, as it ignores a critical factor that can dramatically alter drug concentrations. Failing to account for these interactions can result in unexpected toxicity or loss of efficacy, directly impacting patient safety and contravening guidelines that mandate consideration of all factors influencing drug disposition. A third incorrect approach that relies solely on generic dosing guidelines without assessing individual metabolic capacity is a failure to adhere to best practices in TDM. This approach is ethically problematic as it treats all patients as metabolically identical, ignoring the significant interindividual variability in drug metabolism. This can lead to suboptimal outcomes and is a breach of the professional responsibility to tailor treatment to the individual patient's needs and characteristics, as expected by TDM certification standards. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with identifying the TDM-monitored drug and its known metabolic pathways. Next, the patient's clinical status, including hepatic function, renal function, age, and any known genetic polymorphisms affecting drug metabolism, must be evaluated. Crucially, a thorough review of all concomitant medications is essential to identify potential inducers or inhibitors of relevant metabolic enzymes. Finally, the TDM results should be interpreted in light of this comprehensive metabolic assessment, leading to informed and individualized dosing recommendations. Question 11. Which approach would be most appropriate for a TDM-certified professional when a patient on a narrow therapeutic index anticonvulsant exhibits new-onset neurological symptoms consistent with toxicity, yet their current serum drug concentration falls within the established therapeutic range? Option A. Suggest increasing the drug dosage to overcome the perceived resistance, hypothesizing that the patient's symptoms are unrelated to the anticonvulsant's mechanism of action. Option B. Investigate potential drug-drug interactions that might potentiate the drug's pharmacodynamic effects despite a normal pharmacokinetic level, and consider the drug's specific receptor binding or ion channel modulation properties in the context of the patient's symptoms. Option C. Recommend a dose reduction based on the patient's reported symptoms, assuming the drug's mechanism of action is being overexpressed due to individual patient sensitivity. Option D. Advise the prescriber to immediately discontinue the medication, as the measured drug level is likely inaccurate and the symptoms indicate severe toxicity. The correct answer is C. Recommend a dose reduction based on the patient's reported symptoms, assuming the drug's mechanism of action is being overexpressed due to individual patient sensitivity. Explanation: this scenario presents a common challenge in therapeutic drug monitoring, TDM, where a patient's clinical presentation appears discordant with their measured drug levels, raising questions about the underlying mechanism of drug action and potential confounding factors. The professional challenge lies in accurately interpreting TDM results within the broader clinical context, considering not only pharmacokinetics, but also pharmacodynamics and patient-specific variables, while adhering to established TDM guidelines and best practices. Careful judgment is required to avoid misinterpreting data, leading to inappropriate therapeutic adjustments or diagnostic errors. The correct approach represents best professional practice because it systematically investigates potential reasons for the observed discrepancy by considering the drug's mechanism of action in relation to the patient's specific physiological state and concurrent therapies. This aligns with the principles of evidence-based practice and patient-centered care, emphasizing a comprehensive understanding of how the drug interacts with the body at a molecular and cellular level to produce its therapeutic or toxic effects. It also implicitly adheres to TDM guidelines that advocate for integrating laboratory data with clinical information for optimal patient management. An incorrect approach that focuses solely on adjusting the drug dosage based on the measured level, without considering the mechanism of action or other clinical factors, would be professionally unacceptable. This failure to investigate the root cause of the discrepancy could lead to inappropriate dosing, potentially exacerbating toxicity, or rendering the therapy ineffective, thereby violating the ethical obligation to provide competent and safe patient care. Another incorrect approach that dismisses the measured drug level entirely without a thorough clinical evaluation and consideration of potential assay interference or biological variability would also be professionally unsound. This could result in overlooking a genuine toxicity or subtherapeutic level, again compromising patient safety and the quality of care. The professional decision-making process for similar situations should involve a structured approach. First, critically evaluate the TDM result in light of the patient's clinical presentation and known therapeutic ranges. Second, consider the drug's known mechanism of action and how it might be affected by the patient's disease state, organ function, or concomitant medications. Third, explore potential sources of error, including sample collection, handling, and assay methodology. Fourth, consult relevant literature and guidelines for specific drugs and patient populations. Finally, collaborate with the prescribing physician to develop a rational and evidence-based therapeutic plan. Question 12. The review process indicates that TDM results for patients on certain immunosuppressant are frequently showing variability, leading to uncertainty in dose adjustments. Which of the following actions is most crucial to address this variability and ensure the reliability of TDM results? Option A. Implementing a strict protocol for collecting blood samples at a consistent time relative to the patient's last drug dose, as defined by the drug's pharmacokinetic profile and established TDM guidelines. Option B. Encouraging patients to report their drug administration times as accurately as possible and using these self-reported times for sample interpretation. Option C. Adjusting the interpretation of TDM results based on the perceived clinical status of the patient, rather than strict adherence to timed sample collection. Option D. Prioritizing the rapid collection of blood samples to minimize laboratory turnaround time, even if the exact timing relative to the last dose is not precisely known. The correct answer is A. Implementing a strict protocol for collecting blood samples at a consistent time relative to the patient's last drug dose, as defined by the drug's pharmacokinetic profile and established TDM guidelines. Explanation: the review process indicates a recurring issue with inconsistent therapeutic drug monitoring, TDM, results for patients on specific medications, potentially impacting clinical decision-making. This scenario is professionally challenging because inaccurate TDM results can lead to inappropriate dosing adjustments, potentially causing therapeutic failure or toxicity. The core of the challenge lies in ensuring the reliability of the data used for these critical decisions. Careful judgment is required to identify the root cause of the inconsistency, which often relates to the pre-analytical phase of sample handling. The correct approach represents best professional practice because it directly addresses the most common and significant variable affecting TDM accuracy: the timing of sample collection relative to the last drug administration. Therapeutic drug monitoring relies on measuring drug concentrations at specific time points to assess drug exposure and predict efficacy or toxicity. For many drugs, particularly those with narrow therapeutic indices, the concentration can fluctuate significantly throughout the dosing interval. Collecting samples at a consistent and appropriate time point, e.g., trough, peak, or random, is paramount for accurate interpretation of results and for making informed clinical decisions. This aligns with the fundamental principles of laboratory quality management and patient safety, which are implicitly or explicitly governed by regulatory frameworks that emphasize accurate and reliable testing. An incorrect approach that involves collecting samples at arbitrary times without regard to the dosing schedule is professionally unacceptable. This failure directly violates the principle of obtaining a representative sample for accurate TDM. It leads to results that are not comparable to established therapeutic ranges, which are typically defined for specific collection times. This can result in misinterpretation of drug efficacy, unnecessary dose escalation, or even patient harm due to over- or underdosing. Such a practice would likely contravene guidelines from professional bodies and regulatory agencies that mandate adherence to validated TDM protocols to ensure patient safety and the integrity of diagnostic testing. Another incorrect approach, such as relying solely on patient self-reporting of administration times without a standardized collection protocol, is also professionally unacceptable. While patient adherence is important, self-reporting can be prone to error or misinterpretation. Without a standardized collection time, the laboratory cannot guarantee the sample reflects a consistent point in the dosing interval, rendering the TDM results unreliable for clinical decision-making. This undermines the laboratory's role in providing accurate and actionable information. Finally, an approach that prioritizes sample collection speed over adherence to the specified timing for TDM would be professionally unacceptable. While efficiency is desirable, it must not compromise the scientific validity of the test. For TDM, the timing is not merely a procedural detail. It is a critical determinant of the drug concentration and thus the interpretability of the result. Sacrificing timing for speed would lead to inaccurate data and potentially harmful clinical decisions, failing to meet the standards of professional laboratory practice. A professional decision-making process for similar situations should involve a systematic review of the TDM process, from sample collection to result reporting. This includes understanding the pharmacokinetic properties of the drugs being monitored, the specific timing requirements for each drug's TDM, and the established protocols for sample collection. When inconsistencies arise, the first step should be to investigate the pre-analytical phase, with a particular focus on sample timing. Collaboration with clinical staff to reinforce the importance of correct sample timing and to ensure clear communication of collection requirements is essential. Adherence to established quality control procedures and regulatory guidelines should be the guiding principle in all TDM activities. Question 13. The analysis reveals that a clinical laboratory is considering implementing a new immunoassay for a frequently monitored antiepileptic drug. While the manufacturer claims improved sensitivity, initial internal quality control data suggests a potential for increased false positives in samples with high concentrations of a common metabolite that can cross-react with the assay. This presents a challenge in ensuring the accuracy of therapeutic drug monitoring results for patients on complex medication regimens. Which of the following approaches best addresses this implementation challenge while adhering to regulatory requirements for laboratory testing? Option A. Discontinue monitoring this specific antiepileptic drug until a more reliable assay becomes available to avoid any potential for inaccurate reporting. Option B. Conduct a comprehensive analytical validation study comparing the new assay's results to a reference method, specifically evaluating its specificity in the presence of known interfering substances and common metabolites, and reassessing clinical decision thresholds based on these findings before routine implementation. Option C. Utilize the new assay for patient testing, but only report results for samples with drug concentrations below the previously established therapeutic range, pending further investigation into potential interferences. Option D. Immediately implement the new assay for routine patient testing, relying on the manufacturer's sensitivity claims, and assuming that any observed discrepancies are due to laboratory error that will be resolved through ongoing quality control. The correct answer is B. Conduct a comprehensive analytical validation study comparing the new assay's results to a reference method, specifically evaluating its specificity in the presence of known interfering substances and common metabolites, and reassessing clinical decision thresholds based on these findings before routine implementation. Explanation: the analysis reveals a common implementation challenge in therapeutic drug monitoring, TDM, where a laboratory transitions to a new assay for a critical drug. The professional challenge lies in ensuring patient safety and assay reliability during this transition, particularly when the new assay exhibits different analytical performance characteristics, such as sensitivity and specificity, compared to the previous method. This requires a thorough understanding of the implications of these differences on clinical decision-making and adherence to regulatory guidelines for laboratory validation and quality assurance. The correct approach represents best professional practice because it prioritizes patient care and regulatory compliance. By performing a comprehensive analytical validation of the new assay, including direct comparison with the previous method, assessing the impact of potential interferences, and establishing appropriate clinical decision thresholds, the laboratory ensures that the new assay provides accurate and reliable results. This proactive approach aligns with the principles of good laboratory practice, GLP, and the requirements of regulatory bodies that oversee laboratory testing, ensuring that patient treatment decisions are based on trustworthy data. An incorrect approach that involves immediately implementing the new assay without adequate validation would represent a significant regulatory and ethical failure. This failure stems from a disregard for the established protocols for assay implementation, which are designed to prevent patient harm due to inaccurate testing. Ethically, it breaches the duty of care owed to patients by potentially exposing them to incorrect drug-level interpretations, leading to suboptimal or harmful therapeutic interventions. From a regulatory standpoint, it violates guidelines that mandate the validation of all new laboratory methods before routine use, potentially leading to sanctions or loss of accreditation. Another incorrect approach, such as relying solely on manufacturer-provided performance data without independent verification, also poses regulatory and ethical risks. While manufacturer data is a starting point, it may not fully reflect the assay's performance in the specific laboratory environment or with the local patient population. This can lead to unexpected errors and misinterpretations, again compromising patient safety and violating the principle of due diligence required in laboratory operations. The professional reasoning process for such a scenario should involve a systematic evaluation of the new assay's performance characteristics. This includes understanding the assay's sensitivity, ability to detect low concentrations and specificity, ability to correctly identify the absence of the drug, or differentiate it from similar substances, in the context of the therapeutic range and potential interfering substances. Professionals must consult relevant regulatory guidelines, e.g., CLIA in the U.S., or equivalent national standards, for assay validation and quality control. A critical step is to compare the new assay's results with the previous method using a representative sample set, analyze any discrepancies, and determine their clinical significance. Establishing new reference intervals or decision points, if necessary, based on the validated performance of the new assay is crucial. Finally, clear communication with clinicians regarding any changes in methodology and potential impact on results is paramount. Question 14. The performance metrics show a significant deviation in the TDM results for a patient receiving multiple concomitant medications, raising concerns about potential drug-drug interactions influencing the measured drug concentration. Which of the following actions best addresses this situation? Option A. Immediately adjust the dose of the monitored drug downwards based on the elevated TDM result, assuming the deviation is solely due to patient non-adherence. Option B. Inform the prescriber that a drug interaction is suspected, but provide no further details or analysis regarding its potential impact on the TDM results. Option C. Ignore the performance metrics and proceed with routine TDM interpretation, as drug interactions are too complex to reliably assess in this context. Option D. Review the patient's full medication list to identify known or suspected pharmacokinetic or pharmacodynamic interactions between the prescribed drugs and the monitored therapeutic agent, and assess the potential impact of these interactions on the TDM results before communicating findings to the prescriber. Correct answer is D. Review the patient's full medication list to identify known or suspected pharmacokinetic or pharmacodynamic interactions between the prescribed drugs and the monitored therapeutic agent, and assess the potential impact of these interactions on the TDM results before communicating findings to the prescriber. Explanation. Scenario analysis. This scenario presents a common clinical challenge in therapeutic drug monitoring, TDM, where a patient's medication regimen involves multiple drugs, increasing the risk of clinically significant drug-drug interactions. The performance metrics indicating a potential issue necessitate a proactive and informed response from the TDM professional. The challenge lies in accurately identifying the interaction, assessing its clinical impact on the patient's TDM results, and communicating this information effectively to the prescribing clinician to ensure patient safety and optimize therapy. Failure to do so could lead to misinterpretation of TDM results, inappropriate dose adjustments, and adverse patient outcomes. Correct approach analysis. The correct approach involves a systematic review of the patient's current medications, specifically identifying known or potential pharmacokinetic and pharmacodynamic interactions between the prescribed drugs. This requires consulting reliable drug interaction databases and literature relevant to the specified jurisdiction's regulatory framework for TDM. The TDM professional must then correlate these potential interactions with the patient's TDM results, considering how each drug might influence the measured concentration of the target drug. For example, if a patient is on a drug known to inhibit the metabolism of the monitored drug, an elevated TDM result might be explained by this interaction rather than a need for dose reduction. The professional must then communicate these findings and their potential impact on TDM interpretation to the prescribing clinician, recommending further investigation or clinical assessment as needed. This aligns with the professional responsibility to provide accurate and contextually relevant TDM data, ensuring patient safety and adherence to best practices in pharmacotherapy, as implicitly guided by regulatory expectations for competent practice in TDM. Incorrect approaches analysis. One incorrect approach is to dismiss the performance metrics without further investigation, assuming the TDM results are solely reflective of patient adherence or metabolism. This fails to acknowledge the significant impact drug interactions can have on drug concentrations and TDM interpretation, potentially leading to incorrect clinical decisions and patient harm. This approach demonstrates a lack of due diligence and a failure to apply critical thinking in interpreting TDM data within the broader clinical context, which is a fundamental expectation of TDM professionals. Another incorrect approach is to solely focus on adjusting the monitored drug's dose based on the TDM result without considering the potential drug interactions. This ignores the underlying cause of any observed deviation and could lead to over- or undertreatment. It represents a failure to perform a comprehensive analysis and a deviation from best practices in pharmacotherapy management, potentially violating ethical obligations to provide patient-centered care. A third incorrect approach is to communicate the potential drug interaction to the prescriber without providing any context or potential implications for the TDM results. This creates an incomplete picture and places the burden of interpretation entirely on the prescriber, who may not have the same level of TDM expertise. Effective communication in TDM requires providing actionable insights derived from the interaction analysis, guiding the prescriber towards appropriate clinical decisions. This approach falls short of the collaborative and consultative role expected of TDM professionals. Professional reasoning. Professionals should approach such scenarios by first recognizing the importance of performance metrics as indicators of potential issues. A systematic process of medication reconciliation and drug interaction assessment is crucial. This involves leveraging available resources, such as drug interaction databases and clinical guidelines, to identify potential interactions. The next step is to critically evaluate how these interactions might affect the TDM results and the patient's clinical status. Finally, clear, concise, and clinically relevant communication with the prescribing clinician is paramount, facilitating informed decision-making and ensuring optimal patient care. This process emphasizes a proactive, evidence-based, and collaborative approach to TDM interpretation. Question 15. The monitoring system demonstrates a consistent pattern of collecting drug concentration samples at the trough level immediately prior to the scheduled administration of the next dose, for all patients undergoing therapeutic drug monitoring for a range of medications. This practice is intended to assess the steady-state drug exposure and ensure therapeutic efficacy and safety. Option A. Collect samples at random times throughout the dosing interval. Option B. Rely solely on patient self-reporting of dosing times without system verification. Option C. Collect samples at the peak concentration shortly after drug administration. Option D. Collect samples at the trough concentration immediately before the next scheduled dose. The correct answer is D. Collect samples at the trough concentration immediately before the next scheduled dose. Explanation: the scenario presents a common implementation challenge in therapeutic drug monitoring, TDM, ensuring the accuracy of drug concentration measurements by adhering to precise sample collection timing relative to drug administration. This is professionally challenging because deviations from recommended timing can lead to misinterpretation of drug levels, potentially resulting in inappropriate dose adjustments. Such misinterpretations can have serious clinical consequences, including subtherapeutic efficacy or toxicity, directly impacting patient safety and outcomes. The pressure to provide timely results, coupled with potential variations in clinical workflow and patient adherence, necessitates careful judgment and robust system design. The correct approach, which involves collecting samples at the trough concentration immediately before the next scheduled dose, represents best professional practice because it directly aligns with the established pharmacokinetic principles for most TDM-indicated drugs. This timing provides the most reliable indicator of the drug's steady-state accumulation and the patient's ability to clear the drug. Regulatory guidelines and professional standards for TDM certification consistently emphasize trough sampling for drugs where this is the established method for assessing efficacy and safety. Adhering to this timing ensures that the measured concentration reflects the lowest point in the dosing interval, allowing for accurate assessment of whether the drug is within the therapeutic window. An incorrect approach of collecting samples at random times during the dosing interval is a significant regulatory and ethical failure. This violates fundamental TDM principles and the implicit expectation that certified professionals will adhere to validated methodologies. Random sampling does not provide a consistent or interpretable drug concentration, making it impossible to reliably assess therapeutic efficacy or toxicity. This failure could lead to incorrect clinical decisions, potentially harming patients and violating the duty of care owed to them. Another incorrect approach, collecting samples at peak concentration for drugs where trough levels are indicated, also represents a regulatory and ethical failure. While peak levels are important for some drugs, e.g., certain antibiotics, their measurement at the wrong time for other drugs can lead to misleading interpretations. For drugs requiring trough monitoring, measuring at peak can overestimate drug exposure and lead to unnecessary dose reductions, potentially compromising therapeutic outcomes. This demonstrates a lack of understanding of drug-specific pharmacokinetic profiles and a failure to apply appropriate TDM protocols, which is a breach of professional standards. Finally, an incorrect approach of relying solely on patient self-reporting of dosing times without independent verification or system prompts is also a regulatory and ethical failure. While patient cooperation is important, TDM relies on objective and accurate data. Self-reporting is prone to error due to patient recall issues, misunderstanding of dosing schedules, or non-adherence. A system that does not incorporate mechanisms to ensure accurate sample timing, such as automated reminders or integration with electronic health records for dosing confirmation, fails to uphold the rigor required for reliable TDM and can lead to the same clinical misinterpretations as other timing errors. The professional decision-making process for similar situations should involve a thorough understanding of the specific drug's pharmacokinetic profile and the established TDM guidelines for that drug. This includes identifying the appropriate sampling time, trough, peak, or random, and ensuring that the clinical workflow and monitoring system support adherence to this timing. When implementing or evaluating a TDM system, professionals must prioritize accuracy and reliability by verifying that sample collection protocols are consistently followed. If deviations occur, a systematic approach to identify the root cause and implement corrective actions is essential to maintain patient safety and regulatory compliance. Question 16. During the evaluation of a patient's theophylline level, The result is significantly lower than expected based on the prescribed dosage and the patient's known pharmacokinetic profile. Which of the following approaches represents the most appropriate risk assessment for identifying potential pre-analytical variables affecting this drug level? Option A. Focusing solely on the reported theophylline level and comparing it to standard therapeutic ranges. Option B. Assuming a laboratory error and initiating a repeat sample collection without further investigation. Option C. Reviewing the patient's clinical presentation for signs of theophylline toxicity and inquiring about the timing of the last dose relative to sample collection. Option D. Immediately questioning the patient's adherence to the prescribed theophylline regimen. The correct answer is D. Immediately questioning the patient's adherence to the prescribed theophylline regimen. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic drug monitoring, TDM, where a seemingly straightforward interpretation of a drug level is complicated by potential pre-analytical variables. The professional's task is to identify the most likely cause of a discrepant result, which requires a systematic approach to risk assessment rather than a superficial glance at the number. The challenge lies in distinguishing between a true therapeutic failure, a laboratory error, or a patient-specific factor that has altered the drug's pharmacokinetics or pharmacodynamics, all of which have significant implications for patient care and safety. Correct approach analysis. The correct approach involves a comprehensive review of the patient's clinical status and the circumstances surrounding sample collection. This aligns with best professional practice by prioritizing patient safety and ensuring the accuracy of TDM results. Specifically, it necessitates considering factors such as the timing of the last dose relative to sample collection, potential drug interactions, changes in renal or hepatic function, and adherence to the prescribed regimen. These are all recognized pre-analytical variables that can significantly impact drug concentrations and are within the scope of a TDM professional's responsibility to assess. This approach is ethically sound as it aims to provide accurate information for clinical decision-making, thereby optimizing patient outcomes and preventing potential harm from misinterpretation of drug levels. Regulatory guidelines for TDM emphasize the importance of understanding and mitigating pre-analytical variables to ensure the reliability of laboratory data. Incorrect approaches analysis. Focusing solely on the drug level without considering the clinical context or sample collection details represents a significant regulatory and ethical failure. This approach ignores the fundamental principle that drug levels are only meaningful when interpreted within the patient's overall clinical picture. It is professionally unacceptable because it risks misdiagnosing therapeutic failure or toxicity, leading to inappropriate dose adjustments or continued ineffective treatment. Such an approach fails to adhere to the standards of care expected in TDM, which mandate a holistic assessment. Attributing the results solely to a laboratory error without a systematic investigation of pre-analytical factors is also professionally unsound. While laboratory errors can occur, a premature assumption without due diligence can lead to unnecessary investigations and a delay in addressing the actual cause of the aberrant drug level. This approach bypasses the critical step of risk assessment for pre-analytical variables, which is a core competency in TDM. Assuming the patient is non-adherent without further investigation is another flawed approach. While non-adherence is a potential pre-analytical variable, it should be a conclusion reached after ruling out other factors, not an initial assumption. This can lead to patient stigmatization and can mask other underlying issues affecting drug absorption or metabolism. It fails to uphold the ethical principle of patient-centered care and can undermine the therapeutic relationship. Professional reasoning. Professionals should adopt a systematic risk assessment framework when evaluating TDM results. This involves 1. Reviewing the drug level in conjunction with the patient's current clinical status, including signs and symptoms of efficacy or toxicity. 2. Inquiring about the timing of the last drug dose and sample collection to assess for appropriate interval. 3. Investigating potential drug-drug interactions based on the patient's medication list. 4. Considering any recent changes in the patient's physiological status, such as renal or hepatic function. 5. Evaluating the possibility of patient adherence issues, but only after other pre-analytical factors have been considered. This multifaceted approach ensures that the TDM result is interpreted in its entirety, leading to more accurate and effective patient management. Question 17. The assessment process reveals that a TDM sample for a patient on vancomycin was collected 45 minutes after the scheduled trough time due to nursing staff being occupied with other patient care needs. The sample was then placed in a standard transport tube at room temperature and sent to the laboratory. Which of the following actions best reflects the appropriate professional response in this situation? Adhering to TDM certification standards. Option A. Inform the laboratory of the delay in room temperature transport and request they proceed with analysis, noting the potential for compromised accuracy. Option B. Discard the sample and wait for the next scheduled collection time, as the integrity of the current sample is irrevocably compromised. Option C. Accept the collected sample as is, assuming the slight delay in room temperature transport will not significantly impact the vancomycin trough level. Option D. Immediately recollect the sample at the earliest possible opportunity, ensuring it is properly chilled and transported according to laboratory protocol, and document the reason for the recollection. The correct answer is D. Immediately recollect the sample at the earliest possible opportunity, ensuring it is properly chilled and transported according to laboratory protocol, and document the reason for the recollection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the TDM certified professional to balance the immediate need for accurate therapeutic drug monitoring results with the practical constraints of sample collection in a dynamic patient care environment. The integrity of the TDM result is paramount for patient safety and effective treatment, but delays or improper handling can compromise this integrity. The professional must exercise sound judgment to ensure compliance with established protocols while minimizing disruption to patient care. Correct approach analysis. The correct approach prioritizes the immediate collection of the sample at the prescribed time, followed by prompt and appropriate handling. This aligns with the fundamental principles of TDM, which dictate that sample timing relative to dosing is critical for accurate interpretation of drug concentrations. Regulatory guidelines and best practices for TDM certification emphasize the importance of adhering to collection schedules to ensure that the measured drug level reflects the patient's pharmacokinetic status at a specific point in time. Proper handling, including immediate chilling or transport to the laboratory as per protocol, prevents sample degradation and ensures the accuracy of analytical testing. This approach upholds the highest standards of patient care by providing reliable data for clinical decision-making. Incorrect approaches analysis, delaying sample collection until a more convenient time for the phlebotomist or nursing staff, without considering the impact on the drug's pharmacokinetic profile, is a significant regulatory and ethical failure. This directly compromises the accuracy of the TDM result, potentially leading to incorrect dosage adjustments, suboptimal therapy, or adverse drug events. It violates the core principles of TDM and the responsibilities outlined in TDM certification standards, which mandate adherence to collection protocols. Collecting the sample but failing to follow the specified handling instructions, e.g., not chilling a temperature-sensitive sample or not transporting it promptly, also constitutes a regulatory and ethical failure. This can lead to inaccurate assay results due to drug degradation or instability, rendering the TDM data unreliable. Such actions undermine the laboratory's ability to provide accurate results and can lead to misinterpretation by the clinician, impacting patient care. Failing to document the exact time of collection or any deviations from the protocol is another critical failure. Accurate documentation is essential for the interpretation of TDM results and for quality assurance. Without precise timing, the clinical significance of the drug concentration is diminished, and it becomes impossible to assess the validity of the sample in relation to the dosing regimen. This omission violates record-keeping requirements and compromises the traceability and reliability of the TDM process. Professional reasoning. Professionals in TDM certification must adopt a decision-making framework that prioritizes patient safety and data integrity. This involves 1. Understanding and strictly adhering to established protocols for sample collection timing and handling. 2. Recognizing the critical impact of timing on drug concentration interpretation. 3. Proactively communicating with clinical staff to facilitate timely sample collection. 4. Ensuring all necessary steps for sample integrity are followed, including appropriate labeling, transport, and storage. 5. Meticulously documenting all aspects of the collection process, including any deviations and their rationale. When faced with potential conflicts or challenges, the professional's primary responsibility is to ensure the accuracy and reliability of the TDM data, even if it requires additional effort or communication. Question 18. The efficiency study reveals a statistically significant increase in adverse drug reactions, ADR, among patients prescribed a new antibiotic with a narrow therapeutic index. Which of the following actions best reflects a professional and regulatory compliant response to this finding? Option A. Initiate a comprehensive review of patient drug levels, clinical presentations, and potential contributing factors to understand the cause of the increased ADRs and collaborate with prescribers on management strategies. Option B. Focus solely on the cost savings associated with the new antibiotic, assuming the observed ADRs are within acceptable limits for a new drug. Option C. Immediately discontinue the new antibiotic for all patients without further assessment to eliminate the risk of ADRs. Option D. Continue current prescribing practices, attributing the ADRs to patient-specific comorbidities rather than the new antibiotic, to maintain cost-effectiveness. Correct answer is A. Initiate a comprehensive review of patient drug levels, clinical presentations, and potential contributing factors to understand the cause of the increased ADRs and collaborate with prescribers on management strategies. Explanation. The efficiency study reveals a significant increase in the number of patients experiencing adverse drug reactions, ADR, when prescribed a new antibiotic with a narrow therapeutic index. This scenario is professionally challenging because it directly impacts patient safety and requires a nuanced understanding of drug pharmacology within the context of clinical practice. The core issue revolves around balancing the efficacy of the antibiotic with its potential for toxicity, a critical aspect of therapeutic drug monitoring, TDM. Careful judgment is required to identify the root cause of the ADRs and implement appropriate interventions without compromising patient care or violating regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety by proactively investigating the increased ADRs. This involves a thorough review of patient data, including drug levels, clinical signs and symptoms, and potential drug-drug interactions. It also necessitates collaboration with the prescribing physician to adjust dosages, consider alternative therapies, or implement more frequent monitoring. This aligns with the ethical and regulatory imperative to provide safe and effective patient care, as mandated by TDM certification standards, which emphasize understanding drug disposition and the clinical significance of drug concentrations in relation to therapeutic and toxic effects. An incorrect approach that focuses solely on the cost-effectiveness of the new antibiotic, ignoring the observed increase in ADRs, represents a significant regulatory and ethical failure. This approach prioritizes financial considerations over patient well-being, directly contravening the fundamental principles of patient care and the responsibilities inherent in TDM. Such a decision could lead to further patient harm, potential litigation, and disciplinary action for failing to adhere to professional standards. Another incorrect approach that involves continuing the current prescribing practices without further investigation, assuming the ADRs are isolated incidents or unrelated to the new antibiotic, is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to respond to emerging safety signals. It neglects the responsibility to monitor drug therapy and identify potential problems, which is a cornerstone of TDM. This inaction could result in continued patient harm and a breach of professional duty. A third incorrect approach that involves immediately discontinuing the new antibiotic without a comprehensive assessment of its necessity and the patient's clinical status is also flawed. While addressing ADRs is crucial, an abrupt cessation without considering the potential consequences for patients who may be benefiting from the drug or the availability of suitable alternatives can be detrimental. This approach lacks a systematic and evidence-based decision-making process. The professional reasoning process for similar situations should involve a systematic approach. 1. Recognize and document the observed trend increased ADRs. 2. Initiate a thorough investigation to identify potential causes, including drug levels, patient factors, and drug interactions. 3. Consult with the prescribing physician to discuss findings and collaboratively develop an evidence-based management plan. 4. Implement the agreed-upon plan, which may include dose adjustments, alternative medications, or enhanced monitoring. 5. continuously evaluate the effectiveness of interventions and patient outcomes. This iterative process ensures that patient safety remains paramount while optimizing therapeutic outcomes. Question 19. Regulatory review indicates that a clinical laboratory is evaluating new methods for therapeutic drug monitoring of a specific immunosuppressant drug used in transplant patients. The laboratory is considering a rapid, cost-effective immunoassay, a versatile high-performance liquid chromatography (HPLC) method, and a highly specific liquid chromatography tandem mass spectrometry (LCMS/MS) technique, which approach best aligns with regulatory expectations for ensuring accurate and reliable patient results in this critical clinical context. Option A. Implementing the LCMS/MS method due to its superior specificity and sensitivity, which minimizes the risk of interference and ensures definitive quantification of the immunosuppressant drug. Option B. Adopting the immunoassay due to its faster turnaround time and lower per-test cost, which are prioritized for high-volume immunosuppressant drug monitoring. Option C. Continuing with the laboratory's existing method, which has been in use for many years and has a history of acceptable performance. Option D. Utilizing the HPLC method as a balance between cost and performance, assuming it has been previously validated for other drug classes. The correct answer is A. Implementing the LCMS/MS method due to its superior specificity and sensitivity, which minimizes the risk of interference and ensures definitive quantification of the immunosuppressant drug. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic drug monitoring, TDM, where a laboratory must select the most appropriate analytical method for a specific drug. The challenge lies in balancing accuracy, precision, turnaround time, cost, and the specific clinical context of the drug being monitored, all while adhering to regulatory requirements for laboratory testing. The choice of method directly impacts patient care by influencing treatment decisions. Correct approach analysis. Selecting a method that offers superior specificity and sensitivity, such as LCMS/MS, for drugs with complex matrices or where cross-reactivity is a concern, represents best professional practice. This aligns with regulatory expectations for accurate and reliable test results, as mandated by bodies like the College of American Pathologists, CAP, or the Joint Commission, which emphasize the need for validated methods that minimize interference and ensure patient safety. The ability of LCMS/MS to provide definitive identification and quantification is crucial for drugs where precise levels are critical for efficacy and toxicity. Incorrect approaches analysis. Choosing an immunoassay solely based on its speed and lower cost, without adequately validating its specificity for the target analyte in the patient population, poses a significant regulatory and ethical risk. Immunoassays can be prone to cross-reactivity with structurally similar compounds or metabolites, leading to inaccurate results and potentially inappropriate clinical decisions. This failure to ensure analytical accuracy and minimize interference violates fundamental principles of good laboratory practice and patient safety, which are core tenets of laboratory accreditation and regulatory oversight. Opting for HPLC without considering the specific drug's properties and the potential for co-eluting interfering substances, or if the required sensitivity cannot be achieved, is also problematic. While HPLC is a versatile technique, its specificity can be lower than LCMS/MS for certain analytes, and its sensitivity may not be sufficient for drugs requiring very low therapeutic ranges. This could lead to under- or overestimation of drug concentrations, impacting patient management, and potentially violating the requirement for accurate and reliable testing. Selecting a method based on historical use within the laboratory, without re-evaluation for current clinical needs or advancements in analytical technology, is a failure to maintain current best practices. Regulatory bodies expect laboratories to periodically review and update their methodologies to ensure they remain appropriate, accurate, and efficient, reflecting the evolving landscape of diagnostic testing and patient care. Professional reasoning. Professionals should approach method selection by first understanding the drug's pharmacokinetic properties, therapeutic range, potential for interference, and the clinical question being asked. This should be followed by a thorough review of available analytical methodologies, considering their reported performance characteristics, accuracy, precision, sensitivity, specificity, linearity, and robustness. A risk-benefit analysis, including cost and turnaround time, should be conducted, but never at the expense of analytical integrity and patient safety. Method validation according to established guidelines e.g., CLIA in the U.S. or equivalent national standards is paramount, and ongoing quality control must be robust. Question 20. Market research demonstrates that a pharmaceutical company is actively promoting a new therapeutic drug that requires TDM for optimal dosing. The company offers clinicians who prescribe their drug a significant financial incentive in the form of sponsored continuing education programs that exclusively feature their product, along with a dedicated support team to assist with TDM interpretation for their specific medication. As a certified TDM professional, how should you ethically navigate this situation to ensure patient care remains paramount? Option A. Critically evaluate the company's claims, seek independent data on the drug's efficacy and safety, and base TDM decisions solely on patient-specific needs and established evidence-based guidelines, irrespective of the company's incentives. Option B. Accept the sponsored continuing education and utilize the company's support team to streamline TDM interpretation, as this will improve efficiency and patient outcomes through faster access to their drug. Option C. Prioritize prescribing the company's drug due to the convenience of their support services, ensuring that TDM is performed as recommended by the manufacturer to facilitate its use. Option D. Engage in the sponsored continuing education to gain insights into the drug's TDM requirements, and then incorporate the company's recommendations into your practice to demonstrate support for their product. The correct answer is A. Critically evaluate the company's claims, seek independent data on the drug's efficacy and safety, and base TDM decisions solely on patient-specific needs and established evidence-based guidelines, irrespective of the company's incentives. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a pharmaceutical company's commercial interests and the clinician's primary responsibility to patient well-being. The clinician is being offered a financial incentive that could subtly influence their prescribing decisions, potentially compromising the objective selection of the most appropriate TDM-guided therapy for a patient. The core of the challenge lies in maintaining professional integrity and patient advocacy when faced with inducements that could introduce bias. Correct approach analysis. The correct approach prioritizes patient welfare and objective clinical decision-making, aligning with the ethical principles of TDM certification and professional conduct. This involves critically evaluating the information provided by the company, seeking independent verification of efficacy and safety data, and ultimately basing treatment decisions solely on the patient's clinical needs, TDM results, and evidence-based guidelines. This approach upholds the clinician's duty of care and ensures that TDM is utilized as a tool for optimizing patient outcomes, free from commercial influence. Regulatory frameworks governing medical practice and professional certifications emphasize patient safety and ethical conduct above all else. Incorrect approaches analysis. One incorrect approach involves accepting the company's offer of sponsored continuing education that focuses exclusively on their specific drug. This is ethically problematic because it creates a potential conflict of interest. The educational content may be biased, presenting a one-sided view of the drug's benefits without adequate discussion of alternatives or potential drawbacks. This could lead to an undue preference for the sponsored drug, undermining the principle of evidence-based, patient-centered TDM. It fails to uphold the professional obligation to seek balanced and objective information. Another incorrect approach is to readily adopt the company's proposed TDM monitoring schedule for their drug without independent clinical assessment. This bypasses the clinician's professional judgment and the need to tailor TDM to individual patient factors and the specific drug's pharmacokinetic profile. Relying solely on a manufacturer's recommendation, especially when coupled with a commercial incentive, risks suboptimal patient care and may not align with established TDM best practices or regulatory guidelines for drug monitoring. Demonstrates a failure to critically evaluate information and apply independent clinical reasoning. A third incorrect approach is to prioritize prescribing the company's drug due to the perceived ease of access to their support services. While patient support can be valuable, it should not be the primary driver of a therapeutic decision. This approach prioritizes convenience and potential benefits to the clinician's practice over the patient's optimal clinical outcome. It suggests a compromise of professional ethics by allowing external factors to unduly influence treatment selection, potentially leading to a suboptimal choice for the patient. Professional reasoning. Professionals facing such situations should employ a decision-making framework that begins with identifying potential conflicts of interest. They must then critically evaluate all information, seeking diverse and unbiased sources. The paramount consideration must always be the patient's best interest, guided by evidence-based practice and professional ethical standards. Transparency regarding any potential conflicts of interest is also crucial. If an offer presents a clear conflict, it should be declined or managed with extreme caution to ensure it does not influence clinical judgment.